Imagine that you're driving to work and suddenly begin having chest pain. You think it's probably just that pesky indigestion again, but you decide to drive yourself to the emergency room to be safe. The waiting room's busy, but your friends have told you that you get seen quickly. You think you may even make it to work, just a little bit late. While you wait to see your nurse, you overhear that she has 4 other critical patients. You watch the clock as the minutes go by. You hear alarms going off in a room across the hall and watch as several nurses and doctors race in, and you wonder if one of those nurses is yours. More alarms go off in the room next door. More staff rush in. You feel as if an elephant is sitting on your chest, and you are beginning to feel clammy and nauseous. You still haven't seen your nurse. Suddenly, the room blurs and you collapse. The sound of alarms going off in your own room begins to fade into the distance as your world goes black. My name is Marina Neal, and I'm a BSN prepared nurse working in South Carolina, and I am passionate about federal mandated nurse staffing ratios because I have seen firsthand the effect high patient-nurse ratios have on the patients and the nurses. Mandated nurse staffing ratios lower the number of patients per nurse and have been shown to reduce medical errors, complications, readmission within 30 days of discharge, and nurse turnover rates. In 1999, California became the first state to implement mandated nurse staffing ratios. Several studies have shown positive outcomes for both the patients and the nurses with this implementation. A 2013 study by McHugh and Ma found that each patient above the baseline of 1 nurse to 4 patients had a 9% increase in the likelihood of complications, including heart failure, heart attack, and pneumonia. Additionally, there's a 7% increase in their likelihood of death within 30 days. High patient loads have a poor effect on nurses. Burnout is a common occurrence in the nursing profession and is preceded by stress and high patient loads. In 2014, the Robert Wood Johnson Foundation cited a statistic showing that within the first year of graduation, 1 out of 5 new nurses will leave the profession. By year 2, 1 out of 3 will leave. High turnover rates are costly for hospitals. The cost of replacing a registered nurse is between $40,000 and $80,000. California nurses self-report more favorable working conditions and increased job satisfaction related to the decreased patient load. The Registered Nurse Safe Staffing Act ensures safe staffing standards are met, imposes monetary penalties for violations, requires public reporting of staffing information, and ensures that nurses are not forced to work without orientation or in units that they are not adequately trained. Currently, most states do not have a regulation on nurse staffing. The proposed federal staffing regulation would require a 1-to-1 nurse-patient ratio for the operating room and trauma patients in the emergency room, a 1-to-2 nurse-patient ratio for critical areas, and a 1-to-3 ratio for step-down, telemetry, and the emergency room. Medical surg and psych floors have a ratio of 1-to-4. Reducing nurse-patient ratios greatly reduces failure to rescue, medical errors, and unfinished nursing tasks, and the likelihood of readmission within 30 days. Additionally, proper staffing ratios have been linked to greater nurse satisfaction and decreased burnout and nurse turnover rates. You can make a difference in the care that you and your loved ones receive. Make your voice heard and promote the Registered Nurse Safe Staffing Act of 2015 and Bill H.R. 2581 by writing to your legislator and the hospital board of directors about this important issue. Thank you for your attention. Imagine that you're driving